I'm Prue from Australian Skin Clinics Garden City, and I'll be showing you a clean and tidy workspace. So as you can see, this is our treatment room. We have our treatment bed covered in a disposable sheet and a disposable blue at the top. All of your machines are tidily placed against walls as a no tripping hazard. On our bench, which is our workspace, is a clean and tidy area with no dust or debris showing. I'll now demonstrate correct hand washing techniques. I'm Prue from Australian Skin Clinics Garden City, and I'll be showing you a clean and tidy workspace. So as you can see, this is our treatment room. We have our treatment bed covered in a disposable sheet and a disposable blue at the top. All of your machines are tidily placed against walls as a no tripping hazard. On our bench, which is our workspace, is a clean and tidy area with no dust or debris showing. So prior to our treatment with an RF, we do a full skin consultation to make sure our client is an adequate candidate, including any contraindications. We also provide a little DL flyer, which includes any pre and post care. We also go through this verbally with the client after the treatment and before they leave to make sure they're 100% understanding of the necessary requirements for this treatment. So for our RF treatment, we have our equipment neatly placed on our bench. We have our RF tip, which is individually wrapped and disposable, our Rejuvenate, which is our aftercare product, our Chlorhexidine, which we cleanse the skin, gauze, a protective headband, and our numbing cream, which is applied by our registered nurse. Towards our sink, we have our Fibella, just for cleansing the area and wiping off any extra product, your hand cream, and any of your other products needed. Okay, so after our treatment is completed and our client has left, we need to dispose of all of our equipment properly. So obviously our single-use bedsheet and our single-use bluey are removed and placed in the bin. If these are soiled by any type of blood or bodily fluid, they are removed in the necessary protocol. From here, we have our RF tip. We dispose of this as it is a needle base and has come into contact with the skin into the sharps bin. Any of our needles, so our micro lances, are also removed and placed in the sharps bin. Our personal care use, including our gloves, any of our gauze and our little mouthpiece is wrapped up in our tea towel and placed in our lined lidded bin. So to finish off for our RF treatment and any of our treatments performed here at Australian Skin Clinics, we then write a full noted record for the client and what we've done for the treatment, and also how we've disposed of all of our equipment according to Australian guidelines. As previously discussed and showed, in our RF treatment we don't have any equipment that is actually needing to be disinfected, as it is all disposed of and individual use. So I'm just going to show you how we disinfect and sterilise our microdermabrasion equipment and tips just for the purpose of the assessment.